Today's topic of discussion is excretion. What is excretion? Excretion is the passage out of systemically absorbed drugs. So, finally, passage out of the drugs in the form of urine, excreted out of the body. What is excretion? For understand excretion, we want to understand two terms. What are the two terms? First one is rate of elimination and clearance. Rate of elimination and clearance. If we understand these two terms, it will easy for understand that mechanism of excretion of the drugs from kidney. So first one is rate of elimination. What is rate of elimination? Now we want to look at rate of elimination. Can you see this is kidney, yellow color organ. This is blood entering in the kidney. This is efferent arterioles. And blood is coming out of kidney. This one is the efferent arterioles. And inside this efferent arterioles, this is the drugs. When it is going to kidney, a portion of drugs is excreted in the urine, and the remaining portion will come back to that efferent arterioles. So this one is the kidney drugs. A portion of the drugs excreted in the urine, remaining portion will come back, okay, by here will come back here, efferent arterioles. Now the remaining portion will go to that efferent in the next cycle. Again, in this next cycle, a little bit is excreted, the remaining will go there. So remaining will go here. Again the next cycle, a little is excreted, a little bit is excreted, the remaining will go. So one time, so finally one time will go the drugs completely excreted out. Finally all the drugs excreted out. So this is known as rate of elimination. So drugs, it repeated so many cycles, then after that all the drugs excreted in the form of urine. So this is known as rate of elimination. Rate of elimination is how much is excreted, so how much amount of drugs excreted. Okay, rate of elimination is how much is excreted per unit time, how much drugs is excreted in urine. So rate of elimination, how much drugs excreted in urine per unit of time, how much drugs is excreted upon per unit of time. It can be minutes, or it can be a second, or it can be hour. Per minute or per second or per hours, how much drugs is excreted. So here 500, okay, here we can see 500 milligram per minute. So it is gram per, so it is gram per time. How much drugs is excreted? Here gram, microgram per time. So here milligram, there are using microgram or milligram. Timing per second or per minutes per hour. This one name is called as rate of elimination. It can be fast or it can be slow. Some drugs it very fast excreted, and some drugs it becomes zero. Okay, some drugs fast, some drugs it becomes zero, slow only. So in this one 500 mg per minute, gram per time. So very fast it will become zero in the blood. but in some drugs it is slowly little bit every time in the circle, a little bit excreted, so multiple cycle are required, so it takes long to get excreted out. Some drugs can be fast excreted very fast, it will be zero in the blood, but some drugs slowly a little bit, so every cycle little bit only excreted, so multiple cycles are required, so it takes long to get excreted. What is clearance? This is efferent arterioles, and this one is the efferent arterioles. Kidney, this organ excretion, okay, here the drugs excretion, from which the drugs is excreted in the form of urine. In kidney is the drugs excreted in the form of urine. In the urine the drugs is excreted out. So when efferent arterioles in the plasma is going inside kidney, plasma is going inside kidney, little bit of drugs is excreted, little bit of the drugs is excreted, not all drugs, okay, not all drugs. For example it containing 10 microgram per ml, 10 microgram per ml. This is the plasma concentration of the drugs. This is known as PC, plasma concentration. Plasma concentration, how much drugs is presented in front arterioles? It can be any. Just suppose here what it is the value, it is 10 microgram per ml. It is the value, it is the plasma concentration, a little bit is excreted. The remaining will go back to that efferent arterioles, okay. What is the concentration? It is less than, okay, here what is the concentration? Less than 10 microgram. Why it is less than 10? Because little bit excreted here, so it means a little bit of plasma cleared of the drugs. We have 5 liter of plasma, the drugs is uniformly distributed in 5 ml of plasma. We have taken any drugs, it is going in blood. All adult human having 5 liter of plasma, so the drugs is uniformly distributed. Now we want to excrete the drugs, so every time blood is going into that kidney, every time excreting a fraction of that drugs in the urine, so little bit of plasma get cleared, little bit of plasma get cleared of the drugs every time. So a little bit one time will come in multiple cycle, okay, the complete process it required a multiple cycle, that complete 5 liter is getting cleared, so this one name is called as clearance. Plasma 5 liter plasma cleared, this one name is called as clearance. So how much ml of plasma? What is the volume of plasma which get completely cleared of the drugs in 1 minute? That is known as clearance. The rate of elimination was easy, but clearance is difficult. So the clearance is the volume of that plasma is get 100% cleared of the drugs per unit time. That is the definition of that clearance. So the formula of that clearance is equal to elimination rate, drugs elimination rate by upon that plasma drugs concentration. So what is the equals? Clearance is equal to drugs elimination rate divided by plasma drugs concentration. So what is the rate of elimination of the drugs? The rate of elimination every time 500 mg is excreted per minute, that is rate of elimination. Okay, rate of elimination, that is the value of R. Rate of elimination we are measuring R. Every minute this much is excreted. And what is plasma concentration? Plasma concentration EC 10 microgram. So the formula for clearance is equal to rate of elimination. So what is the formula? Clearance is equal to that drugs rate of elimination upon plasma drugs concentration. So applied that rate of elimination 500 mg per minute. So what is plasma concentration? 10 mg per ml. So the answer is 50 ml per minute. So this one rate of elimination 500 mg per minute. Plasma concentration 10 mg per ml. So what is the answer? 50 ml per minute. So every minute 50 ml of that plasma get cleared. So 50 50, if you wanted to clear 5,000 every minute 50 is cleared. If you want to record every minute 50, so 50 into 100, that will be 5,000. So in 10 cycle it will be done. So this is clearance. So clearance, the volume of the plasma which get cleared per minute or unit time. Formula R upon PC is the formula. Rate of elimination upon plasma concentration is the formula. Next, order of kinetics. Okay, see this image. Rate of elimination. Rate of elimination directly proportional to plasma concentration. Order. Order of kinetics. Two orders is there. One is zero order kinetics, first order kinetics. Here rate of elimination. So all the drugs follow one of the two order of kinetics, either zero order kinetics or either first order kinetics. So some drugs follow zero order, some drugs follow the first order. What is the meaning by that? Practically how it is important for us for understand this. Can you see this is kidney, this one is efferent arteriole, this one is the efferent arterioles. This efferent arterioles, the blood is entering in the kidney, blood is entering the kidney, and this is the efferent arterioles, the blood is coming out of that kidney. So see this arrow, it will come inside, it is going to outside of that kidney. For example, plasma concentration 10 mg per ml. In 1 ml of plasma, 10 mg of the drugs is present. Okay, 1 ml of plasma, 10 mg of drugs is present. And this is the urine, this one is the urine. Drugs excreted in the urine. How much drugs is excreted? Every minute 1 mg, every minute 1 microgram is excreted. This is rate of elimination. Every minute 1 microgram is excreted. This one is the plasma concentration. Plasma concentration is 10, that rate of elimination is 1. Every minute 1 microgram is excreted when 10 is presented. What suppose 100 is presented means, so, okay, instead of 10, 100 is presented or 1000 is presented. So we increase the plasma concentration. What is the rate of elimination in that case? When plasma 10 mg, just suppose I human taking tablet get observed in that human blood 10 microgram per ml. It can be anything. So every time the human excreted 1 mg, okay, excreted 1 mg every time, 1 mg per unit of time per minutes. In our blood containing 10 uh, 10 microgram, 1 microgram is excreted in urine, but instead of 10, if our blood containing 100 or 1000, what is the rate of elimination? What is the rate of excretion in that case? Okay, in that case it is depends on that order of kinetics. If it is zero order, it is the first order. Okay, it may be zero order or first order. If it is zero order, whatever the rate, so whatever the plasma concentration, rate remain constant 111. Okay, we calling this kidney perfect kidney, disciplined kidney. It always excreted in that same rate. So the in zero order kinetics, which is always same, the rate of elimination is constant. Whatever the plasma concentration, here increasing 100 also, 1000 also, here 111 only excreted. uh, Whatever the plasma concentration, so the zero order is fixed one. Zero order, it is directly proportional to that first order. So if increases the plasma concentration by 10 times, by instead of 10 it is 100 times are increasing, this will also increasing 10 times, this one also increasing 10 times. So instead of 1, it will become 10. Okay, here we are giving 100 means here 10. If we are increasing 100 times, it will become 1000. It will also increasing 100 times. Here 100 means here 10, here 1000 means here 100. So what is the plasma concentration is 10. The excretion is 1. When the plasma concentration become 100, it become 10. When the plasma concentration 1000, it become 100. It become 100. So every time 1/10, every time 1/10 is excreted. So the rate of elimination is directly proportional to the plasma concentration in that first order kinetics. But zero order kinetics, the rate of elimination depending on that plasma concentration. Plasma concentration 10, 100,000 does not matter. Rate of elimination always 111. That is constant, fixed one. So this is the meaning of order of elimination. Zero order kinetics, the rate of elimination is constant. Now there is the formula for rate of elimination is directly proportional to plasma concentration to the power order. What is the formula? Rate of elimination directly proportional to this plasma concentration to that power order. Okay, here that power is order. This is the formula. So we will apply here this order. We are applying zero order kinetics or first order kinetics. So rate of elimination directly proportional to plasma concentration. Here this one is the zero kinetics, so here we are applying 0, here we are applying 1. So apply 0. The rate of elimination is directly proportional to plasma concentration. Here plasma concentration, that power is 0. So the rate of elimination directly proportional to plasma concentration, power 1. Power 1, anything to that power 0, here is 1. So the rate of elimination is constant, 0 order. It does not depending that plasma concentration in 0 order, but first order, the rate of elimination directly proportional to the plasma concentration. So here if you are increasing that concentration, if it is still here increasing concentration still 1 1 1, but here you are increasing that concentration, increasing the concentration. So every time the first order you have seen 1/10 of the drugs is excreted, 1/10 of the drugs is excreted. So here fixed fraction is excreted. So 0 order fixed amount excreted every time 1 1 1. Fixed fraction is exceeded every time. Here 1/10 1/10 1/10. So here we have two type of order, 0 and first kinetics. The plasma concentration to the power of 0 is one rate of elimination is constant. Here that rate of elimination directly proportional to plasma concentration. 0 order kinetics, fixed amount is excreted. Here fixed fraction, okay, fixed fraction is excreted. 0 order fixed amount is excreted. Here fixed concentration fraction is fixed fraction is excreted. 0 order diagram. This one is the first order diagram. See here we having plasma concentration is 10 mg per ml. So the rate of elimination 1 mg per minute. 10 mg per ml. So every time it's only 1 in that cycle. Here 10 also, 100 also, 1000 also, 1 1 1. So if you having 100 here, 1000 here, what will happen instead of 10? If it is 0 order, whatever the plasma concentration, that rate of elimination always 1 1 1 1 1 1. It is always constant. Here point, important point, the rate of elimination is constant. Rate of elimination is the constant one, always constant. Okay, here 0, this one is the 0 order, always constant one. Here we are having 100,000 here, but here it proportional, okay, it's proportional. You increasing it 10 time, 100 time, 1000 time, it will also increasing 10 time, 100 times. So when it is 10 excretion, here 1 mg per minute, here 100. When it become 100, it is 10. When it is 1000, here 100. So it is directly proportional. Every time 1/10 1/10 1/10 is excreted. So here constant fraction is here. Constant fraction is here. So here constant amount is excreted 1 1 1. Here constant fraction is excreted 1/10 1/10 1/10. Here rate of elimination is the constant. Here rate of elimination directly proportional to plasma concentration. So last things is the clearance. What is the formula of clearance? Here rate of elimination upon plasma concentration. Here rate of rate of elimination is the constant one, so clearance indirectly proportional to plasma concentration. Here clearance rate of elimination upon plasma concentration, so here R is directly proportional to plasma concentration, so clearance directly proportional to plasma concentration. So both will rise and both will fall. Here both will rise or both will fall. They will cancel each out, so clearance is the constant one. So zero order clearance is inversely proportional to plasma concentration. First order clearance is constant. So what are the three important point? Rate of elimination here constant. Here rate of elimination directly proportional to plasma concentration. Here fixed one. Okay, every time, every cycle 1 1 1. Here 1/10 1/10 1/10. Here clearance the R is constant and R upon PC. Here R upon PC, but they cancel each other, so they become directly proportional. So either both will increasing or both will fall, but the clearance remain constant. So which drugs is dangerous? Zero order or first order? Zero order only. By mistake, okay, by mistake patient is increasing the dose without consulting a doctor. Doctor asked that patient to take only 10 mg tablet. Patient is taking 100 or 1000 by mistake. Accidentally patient taking. Kidney will excrete 1 1 1. When the patient is taking 10, 1 is excreted, remaining 9 is toxic. When patient is taking 10, instead of he taken 1000, means all the time 1 1 1 only excreted, remaining 9 9 9 will remain, will be bending, so it causes toxicity. The drugs, this is the drugs is dangerous. The zero order is the dangerous one. First order 1/10 is excreted, so not toxic, but zero order toxic only. So zero order kinetics drugs, these are the dangerous drugs. What is the mnemonic? Watt power. Okay, watt power. So list of zero order, this one is the mnemonic. What are the drugs? Dangerous drugs: warfarin, alcohol, aspirin, theophylline, dolbutamide, pinotone. So these are the very dangerous drugs. This comes under zero orders. What are the drugs? Warfarin, alcohol and aspirin, then theophylline, tolbutamide, tolbutamide, then pinolitone. These are the drugs. இந்த வீடியோவில் ட்ரக்ஸ் வந்து எப்படி எஸ்க்ரீட் ஆகுதுன்னு சொல்லி பார்த்துருக்கோம். தட் எஃப்ரண்ட் ஆர்ட்ரியல் மூலமாக கிட்னிக்குள்ளே வந்து எஸ்க்ரீட் ஆகும். ஓகே, எல்லா ட்ரக்ஸும் அட் அ டைம் வந்து எஸ்க்ரீட் ஆகாது, கொஞ்சம் கொஞ்சம் ட்ரக்ஸ் தான் எஸ்க்ரீட் ஆகும். ரிமைனிங் வந்து எஃப்ரண்ட் ஆர்ட்ரியல் மூலமாக இந்த சைக்கிள் வரும். அகெயின் இது மாதிரி இந்த சைக்கிள் வந்து மல்டிபிள்ஸ் சைக்கிள் நடக்கும். அந்த சைக்கிளில் வந்து எத்தனை டைம் வந்து இந்த சைக்கிள் வந்து எக்ஸ்க்ரீட் ஆகுது, அதுதான் வந்து ரேட் ஆஃப் எலிமினேஷன். கிளியரன்ஸுங்கிறது வந்து இந்த பிளாஸ்மாவில் இருக்க ட்ரக்ஸ், ஒவ்வொரு ஹியூமனுக்கும் வந்து 5 ml பிளாஸ்மா இருக்கும். இந்த பிளாஸ்மாவில் இருக்க ட்ரக்ஸ் வந்து எப்போ கிளியரன்ஸ் ஆகுது தான் வந்து கிளியரன்ஸு. எத்தனை டைம் வந்து எலிமினேட் ஆகுது, ட்ரக்ஸ் வந்து எப்படி எலிமினேட் ஆகுறது வந்து ரேட் ஆஃப் எலிமினேஷன். பிளாஸ்மாவில் இருக்கிற ட்ரக்ஸ் வந்து எத்தனை டைம் கிளியரன்ஸ் ஆகுது, அதுதான் வந்து எத்தனை சைக்கிள் இன்வால்வ் ஆகிட்டு கிளியர் ஆகுது, அதுதான் வந்து கிளியரன்ஸ். What is the formula for clearance? Drugs elimination rate divided by plasma drugs concentration. ஆர்டர் ஆஃப் கைனெட்டிக்ஸ், இதுக்கு வந்து ஒரு ஃபார்முலா யூஸ் பண்ணுறாங்க. ரேட் ஆஃப் எலிமினேஷன் டைரக்ட்லி ப்ரொபோஷனல் டு கான்சன்ட்ரேஷன். இங்கே 2 ஆர்டர்ஸ் யூஸ் பண்ணுறாங்க. ஸோ ஆர்டருங்கிற இடத்துல இந்த ஆர்டர் 0 or 1ன்னு அப்ளை பண்ணிவிட்டு நம்மளுக்கு ரிசல்ட்டு கிடைக்கும். 0 ஆர்டரில் வந்து நம்ம ட்ரக்ஸ் கொடுக்குறப்ப நம்ம வந்து ட்ரக்ஸ் வந்து 10 மைக்ரோகிராம் பர் டெசிலீட்டர் கொடுத்தா 1 மில்லிகிராம் பர் 1 மில்லிகிராம் பர் மினிட் வந்து எஸ்க்ரீட் ஆகும். அதே நம்ம இங்கே வந்து ட்ரக்ஸை வந்து இன்க்ரீஸ் பண்ணினாலும் இது வந்து ஒவ்வொரு மில்லிகிராமாக தான் எஸ்க்ரீட் பண்ணும். அதனால இந்த ட்ரக்ஸ் எடுக்கிறது வந்து சப்போஸ் பேஷண்ட் வந்து வித்தவுட் டாக்டரோட அனுமதி இல்லாமல் அவங்க வந்து ட்ரக்ஸை வந்து இன்க்ரீஸ் பண்ணிக்கிட்டு போனாங்கன்னா, சே ஃபார் எக்ஸாம்பிள் 10க்கு பதிலாக டாக்டர் வந்து ரெக்கமெண்ட் பண்ணது வந்து 10, அவங்க வந்து 100ஓ இல்லை 1000ஓ இன்க்ரீஸ் பண்ணாங்கன்னா அது வந்து 1 mg மட்டும்தான் எஸ்க்ரீட் ஆகும். இப்போ 100 எடுத்துக்கிட்டாங்கன்னா 99, 1000 என்ன எடுத்துக்கிட்டாங்கன்னா 999, எல்லாமே பிளட்லேயே இருந்து டாக்ஸிக் ஆகிரும். இது வந்து ரொம்ப டேஞ்சரஸ் கண்டிஷன். இது வந்து சம்டைம்ஸ் டெத்தை கூட காஸ் பண்ணும். அதனால் வந்து அவங்க வந்து 0 ஆர்டர் எடுத்தாங்கன்னா அவங்க வந்து டாக்டர் என்ன ட்ரக்ஸ் சொல்கிறாங்களோ அதை மட்டும்தான் ஃபாலோ பண்ணணும். ஆனால் வந்து இங்கே ஃபஸ்ட்டு ஆர்டர் வந்து அப்படி இல்லை. இங்கே 10 எடுத்தாங்கன்னா 1 mg பர் மினிட் வந்து எஸ்க்ரீட் ஆகும். அதுவே இங்கே 100 எடுத்தாங்கன்னா 10 mg, அதுவே இங்கே 1000 எடுத்தாங்கன்னா 100, 1/10 டைம் வந்து இது வந்து இன்க்ரீஸ் ஆகும். இது வந்து இதை கம்பேர் பண்ணுறப்ப இது வந்து ரொம்ப டேஞ்சரஸ் ஆனது கிடையாது. இதுதான் வந்து 0 ஆர்டர் கைனெட்டிக்ஸ் அண்டு ஃபஸ்ட் ஆர்டர் கைனெட்டிக்ஸ். இதில் வந்து 3 பாயிண்ட் வந்து இம்பார்ட்டண்ட்டானது. இதில் வந்து ரேட் ஆஃப் எலிமினேஷன் எப்பொழுதுமே வந்து கான்ஸ்டண்ட்டாக இருக்கும். 111 என்ன தான் பவர் இன்க்ரீஸ் பண்ணாலும் இது வந்து 111 mg தான் வந்து எஸ்க்ரீட் பண்ணும். இது வந்து டைரக்ட்லி ப்ரொபோஷனல் டு பிளாஸ்மா கான்சன்ட்ரேஷன். ஒவ்வொரு டைமும் 1/10 வந்து இன்க்ரீஸ் ஆகுது. ஸோ ரேட் ஆஃப் எலிமினேஷன் இஸ் கான்ஸ்டன்ட். திஸ் ஒன் இஸ் த ஃபார்முலா. இதில் வந்து நம்ம அப்ளை பண்ணணும். இது வந்து ரேட் ஆஃப் எலிமினேஷன். ஓகே, திஸ் ஒன் இஸ் த proportional to plasma concentration of the drugs. இங்கே வந்து clearance decreases with increasing concentration. here வந்து clearance remaining constant. So clearance directly proportional to plasma concentration. Okay, so here 0 order clearance inversely proportional to plasma concentration. In first order directly proportional to plasma concentration. So clearance is the constant one. So ஃபஸ்ட்டு ஆர்டர் 0 ஆர்டரை கம்பேர் பண்ணுறப்ப ஃபஸ்ட் ஆர்டர் வந்து அவ்வளோக்கா டேஞ்சரஸ் கிடையாது. ஸோ என்னென்ன ட்ரக்ஸ்லாம் வந்து 0 ஆர்டர் அண்டரில் வருதுன்னு சொல்லி பார்த்தோன்னா அதுக்கு வந்து நிமோனிக், வாட் பவர், இதில் இருக்க ஃபஸ்ட் லெட்டர்ஸ்லாம் யூஸ் பண்ணுறாங்க. டோட்டலி 5 இருக்குது. ஏல வந்து 2 ட்ரக்ஸ் இருக்குது. வாட் ஆர் த ட்ரக்ஸ்ன்னு சொல்லி பார்த்தோன்னா வார்ஃபெரின், ஆல்கஹால், அஸ்பிரின், தியோஃபைலின், டோல்புட்டாமைடு அண்டு பைனோட்டோன். These are the drugs, very dangerous drugs. Thanks for watching.